Many Calgary women undergoing mastectomy and breast reconstruction are leaving hospitals sooner with the expansion of a program that offers a new way of caring for surgical patients. Enhanced Recovery After Surgery, ERAS, is a set of practices before, during, and after surgery that's helping patients feel better faster with shorter hospital stays.
There's a number of elements that are involved in making the recovery process smoother and better. And it starts from educating people before surgery about what the recovery process will be like. It involves trying to avoid the lengthy fasting that's involved with surgery, where you can't eat for a long period of time before surgery. It involves multimodal analgesics, so pain medications that work on different parts of the pain system, as well as medications that prevent nausea. And so giving these medications before the pain and nausea start. So they're actually given in pill form before the surgery.
A pilot study involving breast reconstruction patients showed there was no increase in postoperative complications using the ERAS protocols and same-day discharge. Without ERAS, those patients would have been hospitalized overnight. Kirsten Boulay, who had a double mastectomy, was surprised to learn that she would be going home the same day.
I was shocked, if the truth be told. I mean, it was a huge emotional decision to undergo this procedure. And the amount of women that I talked to that said when I told them I was getting a mastectomy, were probably equally shocked that I was going home the same day, or the plan was for that.
Glenda Bonney underwent the more extensive reconstruction with abdominal tissue and says she experienced hardly any nausea after an 8-hour surgery.
I actually only learned of the new protocol after my surgery, the day after my surgery, but just prior, I was given medication and told that it was to help with the nausea. I did have a history of being quite nauseated following my 2 previous surgeries, and I was absolutely thrilled that following the surgery, I was not nauseated. I did not experience any nausea whatsoever.
Overall, patients' recovery and surgery experience is better with ERAS care pathways than with traditional surgical care.
We looked at a validated quality of recovery scale and gave that to women on their first and second day postoperatively, and we also gave it to women who were not on the protocol, and their recovery scores were much higher if they had received the whole pathway of medications and interventions that we do.
My husband was given a medication schedule that he was able to take home, and he had every alarm clock in the house set to make sure I was getting my medication at the time I should have been getting it. And there were no lights, there were no beeping machines, no noises. I was in my own bed. It felt like the right place to be, and really there was a tremendous amount of relief with getting home.
Not everyone's a candidate. You have to be in good health. You have to have a responsible adult at home that can wake you up in the middle of the night, make sure you stay on top of your medications, and you need to be less than an hour away from the hospital just in case there was a complication like bleeding, so that you could get back to the hospital promptly. I think most importantly is we've been able to move this from a 1 or 2 night stay to outpatient surgery, and that has a number of advantages. And also being able to go home is a proxy for the fact that a woman is recovering better.
Plans are underway to ensure the ERAS pathway can be offered to breast reconstruction patients across the province.